Are there any stragglers that might be coming out from the event this afternoon? Some of your folks do?
I think most of them left.
Did we lose them to the sunshine?
Such a large gap.
All right, that will be good feedback for future planning efforts. So welcome. This is the last public health presentation of the week for Public Health Week, and it's about the workforce. So yay us! It's all about us and our workforce. Give ourselves a little pat on the back. I tried to check out the President's Proclamation for Public Health Week, and I did. I printed it off and I read it, and I thought, oh, that sounds very much like Barack Obama. So I'll just give my own congratulations to all of us, and that this is, it's a great privilege to get to be in this workforce, and it's a great opportunity to kind of hear tips from people who are hiring folks, hiring them right now, hiring them in the future. So this was really intended to be the opportunity for students to come and kind of pick brains and hear what hiring managers are interested in and what they're looking for. So I encourage those of you who are students looking to get into the workforce. You've got 5 great, excellent public health professionals here, and you'll get a chance to ask some questions. But I want to get us kicked off before we start asking them to introduce themselves. I just kind of want to recap this week. We've heard a lot about the State Health Improvement Plan. Who's learned something new about the State Health Improvement Plan in Oregon, which includes the strategies around tobacco prevention, obesity prevention, oral health, substance abuse prevention, communicable disease, all these things that are these just foundations of the good work that we do. And we talked about data. There's been a lot of presentations about overviews of programs that have been going on, successes that have happened here in Oregon. And when we think about what this modern public health system might be, there's been conversations around what we're learning through assessments at local and state public health departments and where the gaps are for what we need to address and where we're going. So when we think about that modern public health system, it's really hard to do that when we don't think of the employees and the people who will fill those roles to accomplish the work. And so that's why we wanted to end after we heard from all the students today and saw the posters that you all contributed and worked on and shared your thought and thinking of where we can be in the future. This is how we're going to kind of cap it all off with good feedback from our colleagues. So I'm going to have each panelist introduce themselves. They're going to say who they are and where they work in the public health system. We are focused today on governmental public health. I completely recognize that public health happens through our community partners, through different national organizations and community-based organizations. But today we're talking about the workforce that's really needed for that governmental infrastructure of public health. So we have state public health managers and we have a local public health manager here with us today. So they're going to introduce themselves, tell you that one thing they wish they knew when they were looking for work, and then we'll go into the questions. So I'm going to have Gerard start us off.
Well, hello, I'm Gerard. I'm the Health Promotion and Chronic Disease Prevention Section Manager here at the State Public Health Division. And I've been here for 20 years, which I'm blown away by. And we talked more about how I got here, but it wasn't, I do not have a master's in public health, and I came to public health through the policy side of things. The thing I wish that I had known when I was looking for a job is how valuable my experience and my time is. And I think that when we are looking for jobs, we often feel lucky to get an interview or lucky, to be considered for a position. And in reality, the interviewer is the lucky person that they got your time and your application, and you are considering giving a substantial portion of your every week to this effort. And I think that if people shift their thinking about that, think about what you want to give yourself to, and the interviewer or the hiring person needs to feel grateful, and believe me, we do. We are grateful for your talent and expertise and excitement about this work, and so we are also trying to sell ourselves to you. So I didn't realize that when I was looking for work about how powerful you are as an interviewee. So that's something I wish I had known.
Nice. Well, I'm Collette Young. I am the interim administrator for the Center for Public Health Practice. And I got to public health, let's see, I have a doctorate in nutrition policy and worked overseas. I came to public health because I really enjoy evaluating complex issues. And as it turns out, public health is full of complex issues. And there's beautiful data, and I also love data. So that's how I came here, and that was 10 years ago. I did a lot of things before, just to be clear.
Like what?
But playing off of what you just said, I think that is really true. And the more that you recognize that you are a partner in the interview process, the more that you kind of turn that table into a relaxing and productive conversation. And on that note, I wish someone had told me that it's not all about content expertise, that curiosity and engagement in the conversation is as powerful and will get you a job just as fast. So, thanks.
So I'm Danna. I work at the Office of the State Public Health Director here at the division. I lead the Systems Innovation and Partnerships Unit. And I've been here since 2009 and actually started in the section Karen is in. And the one thing I wish I had known, I'd heard it, but I don't know that I totally believed it, was how little time hiring managers have to review applications. And so how important it is for you to be articulate and specific but succinct when you are talking about the work that, when you're talking about your experience.
Cool. So I have to do a disclaimer. I'm David Howe. Number one, you're all going to be immensely successful because if you haven't noticed, it's Friday, 3:10. The weather's gorgeous out here, and for the students that are pursuing a career in public health, if that's your choice, you will be successful if you're here on a Friday afternoon like the rest of us. The rest of you as employees, I commend you as well. I'm not sure why you're here. And then from a health standpoint, I am the example, I guess, of anti-health because I was told that you've been learning about nutritional things all week long, and here I am drinking my sugar drink. But I want you to know, I went for an iced tea first, and they didn't have it. So I decided I'm going to be naughty, I'm going to do this today. But anyway, that said, I've been with the state for about 8 years. Like Collette, who wouldn't divulge years because that might give her age, I'll give you a little bit. So I started off 8 years as a youth program manager for one of the larger youth agencies in the state. And then I did 20 years in law enforcement, punched the ticket there. So I'm on my third and final career here with public health. And I started as the in radiation protection services with the public health division, as the emergency response manager, technical services, and what else was it? Well, that was basically field operations. So my section does regulation of 4,200 licensees and registrants in the state that use radiation. So it's a whole new field for me, and I really thoroughly enjoy it because of the ability to be in state service. I get a lot of self-fulfillment out of that, and I work with a lot of very committed, dedicated people, like folks up here. So it's very gratifying. The thing I wish I had known when I came in, because again, I came with some experience in different kinds of careers. The rest have talked about the niceties and ideals. I'm going to talk dollars and cents, okay? One of the things that I didn't really appreciate was knowing how they determine starting salaries with state government, okay? When you come in, each of the positions have a classification system of 9 steps. A hiring manager, like ourselves, can only use step 1 or 2 of 9. And after that, you have to go for a salary exception. That salary exception is based on your education, your experience, and your salary history. Some managers may or may not tell you they have the ability to go for a salary exception, so ask. That's all.
That's good advice. That is good advice.
I'm Amanda Garcia-Snell, and I manage the Health Equity Planning and Policy Program in Washington County Public Health. And I forgot what I was, oh yeah, where am I? No, so my program in Washington County has been around for a long time, but it recently has changed its name to really recognize the work that we've been doing for a long time. And it's primarily incorporating equity into foundational public health, as well as working on policy systems and environmental change for chronic disease, upstream chronic disease prevention. So my program is small but mighty, and it includes tobacco prevention, chronic disease prevention, suicide prevention, public health accreditation, school-based health centers, trauma-informed initiative, and I think I might be forgetting something, but it is Friday. I have been in public health for about 10 years, and I had a lot of different types of work prior to that, but 10 years ago I got my master's degree in public health, and one of the things that I wish I had known, which I naively thought that if I got a government job I would never have to write a grant. I can't stress how important it is to hone your grant writing skills and get as much practice and experience with that as you possibly can.
Excellent, thank you all very much. Am I on? There, now I think I'm on. I concur with all of those. That is good advice. Okay, so the next question is, they're all going to address this, and then we're gonna shake it up a little on Friday afternoon. So the first question is, the public health foundational capabilities are the critical knowledge, skills, and abilities necessary to carry out public health activities efficiently and effectively. I'm going to stop and see if folks in this room know what those foundational capabilities are. Have you even heard these? Some? Yes? From the students? It's totally okay. I'm going to explain them. Okay, so there are, as we think about what a modern public health system might look like, there are some key skills that are important for ensuring the workforce has a mix and knows how to do. So are you familiar with the 10 essential services of public health? Yeah, so a lot of that policy and partnerships, surveillance, epidemiology, I'm doing this off memory, communications, health equity, leadership and organization, that direction, that strategic thinking.
Emergency preparedness.
Emergency preparedness, this is why it takes a village to get us through public health. And communicable disease. Environment. Well, that's the foundational program.
Capabilities. Yeah. Community partnership.
I got it. The assessment queen over here says I know them all. No, okay. So those are the general skill sets that we're looking for. That's what we're talking about in those capabilities. So how do we describe those and what are managers looking for? So please reference one of those capabilities, whichever one you want, and describe the attributes you're looking for that would show you that somebody has demonstrated that they have that.
Okay. Sure.
Anna, do you want to start?
Perfect.
Sure, that way. I was afraid someone was going to take mine. Well, I didn't, repeating competencies. So I went with health equity and cultural responsiveness. And I thought about this in terms of you're invited to an interview. How are you going to demonstrate that you understand how to work or how to do health equity in your work? And often we'll ask a question, a cultural competency or health equity or diversity question, and we'll get pretty surface answers, something about, all perspectives need to be respected and we need to understand our differences and our commonalities. But when folks have answered the question with more depth, it's tended to look more like this. They've spoken out of their own experience. And for persons who may not be part of a population that traditionally has experienced health inequities, when they've been able to demonstrate self-awareness and the ability to self-reflect and to talk about an experience where maybe they didn't get it right, and then how that changed them and how they applied that moving forward,
those were really impressive answers, and it helps the interview panel know that you don't just know what health equity is in your head in theory, but you know what it means to live it, and how we are continuously needing to improve in that area personally, but then also as a system. And then the answers from folks who maybe have been from who are from communities that experience health inequities, they've been able to talk out of their experience and what that's like and what they bring to the work environment or to the work as a result of that. And that's been really critical. So I think being able to self-reflect and demonstrate self-awareness, and then talk about how you've applied that new learning moving forward is really critical. And then also where you have the opportunity in the interview to really talk about your understanding about how you would bring that learning to the work of the position, and it would shape how you move forward in doing that work in that position. So we don't get a lot of answers like that to those questions, or at least I don't in interviews. And so it makes a big difference when you're hiring. And if you've got multiple candidates who have the technical competencies and you're maybe thinking about several, being able to genuinely and authentically answer that question could be what puts you over, it could be the tipping point in particular. So that was my reflection on that particular foundational capability.
Danna, David?
All right.
Yeah, we'll go.
I chose leadership and organizational competencies. And as a section manager, there's, I think 16 of us now, or 17 in public health. And I'm going to address it, a candidate for hire. So the first thing I evaluate is whether that person brings in, adequate skills, obviously, transferable knowledge, because not everybody's going to have specific to the position they're applying for, and then usable skills, okay, for the position that they're seeking out. And the second thing I look for is whether they're readily trainable, okay? And I'm going to assume in my case for radiation that they're probably not going to have specific technical skills relating to the job they're going for, but if they're trainable, that makes a huge difference. And for example, it'd be unusual for them to come in and have direct radiation health physics experience as a regulator. It's just simply because there's not very many of them around, okay? Therefore, they have to show me that they're going to be trainable, okay? So as far as it relates to the leadership piece and organizational skills, that's kind of my third one, and in some ways it's the most important. For me, the leadership part begins with them possessing the attributes that make them feel accountable for their own production, and then that allows them to also be in charge and responsible for achieving results with and through others. Okay? So it's also about knowing when you should listen and when you have to have the gumption to take initiative. Some people come in and they've got a lot of great skills and attributes and knowledge, and they start dictating already day one about how it all is. It's kind of surprising. That's a time you listen, that's a time you observe and get through the learning curve, get enough behind you to then know when you can actually start contributing. It doesn't take me too long to see a leader, and I'm always looking for them. I want to know that we have individuals that can come in as new people that can take our organization to the next level and ultimately take my job. That's really what I'm looking for, because I like the idea of long-term success and succession, okay, and transitioning to the next layer or level of leaders. Having technical know-how, time management, project management skills, and you combine that with interpersonal skills, and those are kind of the foundational blocks, being organized, that second part of organizational skills. Most of us can talk about what we need to have happen, but fewer of us can talk about how we're going to make it happen. Okay, there's a big difference. And that's what you need in order to obviously accomplish something. Thanks.
So I chose policy and planning, and I chose that because I think it's one of the, like many of the capabilities with modernization, it's one of the areas where there might be a lot of strengths in one particular program, but there are definitely not strengths across all of the programs within a public health division or a department. And so that's one that I think is really important, and it's something that we haven't always viewed ourselves as experts in, or people that can even provide technical assistance or guidance around these issues. And so I think this is one of those areas where I would look for somebody with some understanding of what that is and what the differences are. I'm going to use a phrase that I hate, but between big P and little p policy. Sorry, Kirsten, I really hate that phrase.
I did not create it. You do use it, I do.
No, I think that policy is complex and nuanced, and people, and maybe a little bit scary because people don't really understand how to go about it, and it's such a useful, and planning as well, and such a really useful and cost-effective way to make major upstream changes. So I would look for somebody that understood it, maybe not necessarily have a lot of experience in it, but certainly know what they're talking about, and then how it might be applied. And that's an area where really thinking creatively about how to incorporate something like policy and planning into programs that don't think of themselves in that term. So an example might be like with Washington County Public Health, we have a maternal child health program that is really focused on it's public health nurses who focus on home visiting, and they don't see themselves in this realm, and this is a place where their knowledge and expertise can really be helpful. And so building those skills, or looking for candidates that have those skills to be able to incorporate and be innovative about how to apply those in different programs where it's not traditional.
I was going to talk about policy and planning as well, and I'm guessing you're going to talk about data, so.
I've got a few choices.
Okay, all right.
I figured this would be an issue.
Okay. So I'll talk about communications, and I agree with what everything everyone else has said, and it all is linked together. But communication skills are really important for taking this complex information for policy change, and how do we share that information with the right people at the right time in the right way, in a way that they can hear it, or how do we get the information to the right messenger to carry that forward is a really important skill that we all need in public health, and likely in any other kind of career that you have. But I agree, it is not subject matter expertise that we are looking for. We are looking for these skills that show that people are able to take a subject, obviously learn some critical information about it, get the appropriate data, figure out who they need to share that with, and get that, where they want to get to, and plan for getting there. I think a lot of times in public health, we each have an area of expertise that we cling to, and it's hard to maybe break out and see how that can be used for greater good, and it is all interconnected. So don't worry if you don't know, if you're not an expert in X. Show that you have the ability to write, communicate, and think through a planning process, and to collaborate with others, and that is extremely valuable. And the other thing I'd want to touch on, what Danna said about bringing your personal experience, is really important. It's okay if you've never worked in public health. You likely have done something that is related to public health, and it might not have occurred to you yet. So think about something that you do in your church or in your neighborhood or with your family, and how you've worked through that issue together or as part of a group, and talk about that and relate that to public health, or relate your personal experience that you went to buy an iced tea and nothing was available, and so you had to buy the sugary drink. So that is an experience that is that shows that you can see how real life experience is applied to public health and think about how you might use that experience to make change for others. So it is really okay to not be a subject matter expert. I really want to get that we have those. and you will become a subject matter expert. What we need is communicators, collaborators, coordinators, people who can see where we need to go and think about how we're going to get there together.
All right, well, I actually have a few notes on, I think, most of the leftovers. So I'm going to cheat a little bit. And this is part of what I've learned, is you wing it when you need to.
Yep.
So assessment and epidemiology. I think the important points I want to make to you about assessment and epi is that, well, first of all, if you're going into public health, you've got to be comfortable with data. You may be a health educator, that might be your focus, but data is going to be your bread and butter. It is literally going to be what you need to write a grant. It's going to be what you need to evaluate your work and to show meaning with your work. And so if you're not comfortable with data or you're afraid of it, challenge yourself, lean into it, because it's the future. And being able to manage it, being comfortable handling it, looking at it critically is a piece of what you're going to do if you're in this field. So that said, in data and epidemiology, I really want to encourage anyone who is invested in any kind of an epi perspective to go out and get some informatics training. You don't have to be a programmer, but you do have to be comfortable picking up new software and not afraid to learn how to use it. And so this is true, isn't it, Steve? This is.
No, I actually just wrote down, get informatics. I made it through after 5 weeks.
It's the future. It's part of the future of public health, and so get comfortable with it, because it's a solution for you, not a problem for you. Health economics. Anybody who has an inkling that they might be interested in health economics, whether it's on the micro level or on the macro level, do yourself a favor and take a class, because we are always looking for health economics. Anybody who either has the skill set and the knowledge or has the interest in it is going to have an upper hand in getting a job. I really am going to move on if it's okay with you. Yeah, okay. So community partnerships, I think a point that was made in a way, but that I want to reiterate in my language, is that we used to do what we thought was a good job in community partnerships. We would push information and education out to people, and then we would pull in data and then use that data to analyze it. And that is not what it's about now. To really be an effective partner in public health, we need to engage, we need to figure out who the population is, who our stakeholders are, and not just the traditional stakeholders, but really the people who are voiceless. Bring them into the conversation as we're planning, bring them into the solutions as we're planning, keep them involved as we evaluate it and see if it's an effective intervention. And if it's not, we need to work with them to admit it and move on. And this is hard work, but it is really what's going to make the difference moving forward. And then finally, I really am touching all of them. Preparedness is the other one I really want to point out to you. I went into public health thinking I wanted nothing to do with emergency preparedness, and found myself managing surveillance for preparedness in H1N1. And what I found was that I actually loved it. And what I love about it is the acute piece of my work. So I manage communicable disease prevention. I love the fact that there is a problem. I use all my skills, the same skills that Karen's team uses in chronic disease prevention, to pull it together, figure out what's going on, and then do my best to solve that puzzle with a team to get an intervention out there to protect people. And that's what preparedness is really all about. You plan, you think about where your risks are, you get ready to respond, you get all your ducks in a row so that on a rainy day we can send out messages to clinicians about Zika shots, anything that you need to think about that's going to help you prepare for your population being inundated with water and the vectors that are going to come with that water. And then you work with them over the course of that response to make sure that their needs are getting taken care of, figure out where your gaps are, and then address it. It's the same program planning that really gets you through it, and it's exciting and so incredibly valuable. So the points I want to make about that are preparedness is not just emergency management. Preparedness is climate change. Preparedness is really an all hazards perspective on what's going on in the world and how you can contribute to it. And when you think about it that way, it's not guys in boots with steel toes. It really is all of us in public health thinking about how we move forward with whatever emerging event is coming up. And that's really, I'm sorry, it's fun, it's exciting. This is what's really amazing about being in public health, is that you can see a problem and you can get out there with a team and address it and make a difference in not just one person's life, but in a community's lives, and it's incredible. And then, of course, evaluate it. Thanks.
Thank you all. There were two things that caught my attention, and I would be remiss if I didn't just throw it out there really quick. One, I also said I would never work in tobacco control, and I could not imagine not having spent the majority of my public health career in tobacco control. So you kind of land in places you never thought were an option for you, and so it's true, it just becomes these wonderful, amazing experiences, because that is where my heart is now. Who knew? And then the second thing I wanted to follow up on was, in all these conversations around these foundational capabilities, the one thing that I think is so important and starts in high school and middle school is it's really great understanding how government works and what your experience and interface is with government. I am constantly looking for my own understanding of the three branches of government, and sometimes we forget that there are three. And so having that, I mean that in the best way possible, but there are three branches, and we've got state and federal and state and local and sometimes county, and we've got our sovereign nations and tribes. And so really understanding some basic good governmental foundations, and again, your interface and interaction with that, it's a great foundation to any public work, whether there's a health behind it or something else. Okay, so we're gonna go into the second question. Which of you want to kind of respond to number two? The second question is, what are the top two qualities you look for in a candidate, and what does it look like when a candidate demonstrates those qualities? So those really good outshining qualities that you're looking for. David, you're going to answer this one?
Yeah, I'll start. Okay. The first thing is, and we kind of touched on this already, is what I look for in a candidate is somebody that can communicate how their skills, their knowledge, and their abilities are transferable to the position they're seeking. For example, again, I'm relating it to my world of radiation. A person might have an experience as a restaurant inspector. And they want to become a radiation health physicist doing X-ray facility inspections. Even though they might have little or no radiation experience, if they're able to articulate that they know how to learn, interpret, and enforce administrative rules, even though it might relate to a restaurant, and that they're competent in doing the inspection process, they're a very viable candidate to me. That's the first one. The other thing I call, and I do this for everybody I bring on new, I kind of go through a one-on-one managerial orientation period where I talk about my expectations of them, and I ask them what their expectations are of me. And one of the things I talk about is, I call it form flex, okay? And what I mean by that, what I mean by form, most organizations have an organizational chart. It's got boxes on it, and it has solid lines connecting the boxes, or maybe they have semi-lines connecting them. And that defines a structure, form. You can even break it down into the position, and you can take it to the individual. You can have charts with boxes representing a person as opposed to a program, and that kind of defines their area of responsibility or their role, okay? That is form, okay? So everybody starts, and some people are real comfortable with form and structure. They kind of survive by that. Well, in this world, and what I've learned in public health, is unlike, it's just the same as any other, the organization's always changing. It's a living entity. okay? So those boxes in that original org chart can change. The boxes can become rectangles, the lines can be reconnected to different boxes, and all of a sudden you got a whole new job, okay? So that's the flex part. You have to be flexible. So people come in, and you see it sometimes in applicants, they come off as though they're fairly rigid. I can't use rigidity in what we do. I need somebody who understands and respects they have a position, responsibilities, and accountability, but they also have to be willing to change, take on new things, think out of the box and become something different. Personal example, radiation section manager who found himself the interim director of the Oregon Medical Marijuana Program. It can happen.
It did.
It did. So that would be my point. I mean, I want people that can perform within the structures defined by their position description, yet at the same time they need to be flexible to take on new things.
Thank you, David. So which one, I'll have two answer this question.
Go ahead.
Amanda, all right.
So I also had nimble or flexibility, and don't worry, I had others too. But I just wanted to mention one thing in regards to that and what other folks have said, that my first job in public health was with a smaller county, with Yamhill County, and I did not envision myself in preparedness or tobacco, but at one point I worked in 7 different programs, and I think I only worked 36 hours a week. And so I think that being nimble or being flexible is so key, because you never know where the money's going to go, and sometimes you want to follow it. So, good job. So one of the other attributes that I had was systems thinker or big picture thinker, and I think it's really easy to say that, but when you get down to any type of large-scale planning, goal setting, or any efforts like that, you find that said is not what it looks like in practice. And so one example I can think of is my team led the community health improvement planning process for Washington County, and we, as you strive to work with 60 different partners to come up with some shared goals, it was really easy to see how folks can just really get mired down in the details and the weeds of their particular focus area, and so being able to step away from that, or really look at the end game, or where you're hoping to go, and plan your route accordingly is so important. And so I think really being able to step back a little and go, oh yeah, it doesn't really matter how we meet these particular partners. It just matters that we get this voice to the table and keep our eye on the prize in that regard. The other thing is critical thinking, which I think is so valuable in a lot of areas of life, but particularly I'm going to try to say this in a delicate way, I guess. But as we are modernizing our public health system, there's a lot of different perspectives about what public health is, or what it should be, or and some of that's based on what it's been, which we're all talking about is not where we see ourselves moving forward in the future, and where we know we haven't always focused on data, and now we're using data to guide our work. So I think really being able to look to question why we're doing things a certain way, and look at innovative ways to maybe improve that, or think differently about how we've been doing our practice. And I think you can't do that without critical thinking skills.
All right, so we'll move to the third question so we can open it up for some Q&A. I'm going to start with Karen for the third question. So when interviewing a candidate, what are 1 to 2 things you hear or observe that moves a qualified candidate down the list? So in other words, what would make someone less competitive?
Okay, one thing is that, as Danna said, hiring managers do not have a lot of time or support in going through the hiring process. So the first thing that we are going to see from you is your application. And if it is full of mistakes or unclear writing, or it's incomplete, it's you know,
It's a non-starter.
that's just shows that, wow, the first thing they're showing me isn't, they didn't even proofread it or something, or have someone else look over it. The other, and that includes like a cover letter or any sort of narrative explaining why we should consider you for that position. Communicating your experience and your interest in the position on your application is really important, and take the time to have someone look over your work before you send it in. The second, and then the other thing I think that hurts people who are otherwise qualified is they just don't show an interest or an enthusiasm or a curiosity about the work. I always, in every interview, I say, do you have any questions for me? And I cannot tell you, over half the time people say, nope. And they walk out. And that's your opportunity to say, hey, I was looking at your website and reading your strategic plan, and here's a question I have about this strategy, or what's a typical day look like, or something like that. Just anything that demonstrates that you are interested in the position and you have some curiosity and enthusiasm for the work. And even if you have to fake it. That's the other thing. If you want it, I get, sometimes you need a job and you're not that excited about it, but you can think of something and just show, and it's every interview is a time to practice those skills. And so go ahead and think of something that you want to know about, and then this is key, and I guess this is back to number 2. Every interview finish with, thanks for your time. I'd like to reiterate, I am very interested in this position, and here's what's great about me. That's your chance to sell yourself. And if they didn't ask you the question that you wished they'd asked you, just say, we didn't cover this in the interview, but I'd like you to know that I have, all of this great experience in this area, and I'm really excited about the job, and I hope to hear from you. That sentence demonstrates interest and curiosity and goes a long way, and will put you above someone who has maybe, more experience or looks better on paper if they are not demonstrating their interest and enthusiasm for the work.
So I will strongly agree with all of that. And just to put a point on that, I just did a set of interviews, and of the 30 applicants I got, 4, instead of writing out everything in the cover letter the way they were asked to do, they wrote "see attached." I guarantee you, I did not look any further at those applications. And it's really easy to do because you're busy and you're cranking out applications, and you think, yeah, sure, it's here, they're gonna see it. You have to be literal on an application.
Sure.
Don't mess with it, or else you'll be ignored because it's too big of a pool. We just don't have time, we have to focus ourselves. And then the other question that I sometimes ask in different ways in interviews, and I'm always shocked by the way people answer it, is one of those kind of questions that goes, think of a time when you had a conflict with someone or you didn't handle something perfectly. And I am shocked by how often people answer without demonstrating that they, instead of being problem-based, they were solution-based. So if I were to go in and answer that question, I would think of a time when especially if it was think of a time you screwed up kind of a question, I would think of a time when I genuinely screwed up, and we're all human, luckily, and so we all do screw up. And then I would frame that as, I did something wrong. The moment I saw I did something wrong, I started looking for a solution that would take care of everybody in the situation. And then talk about that in an honest way. That's the way you answer that question. You don't say, well, I screwed up, but it wasn't really my fault because Sarah didn't, And when you answer that way, you are showing another thing that was talked about here, which is that you are not flexible enough to think about, here's my role, here's not my role, and you're showing that I had a little narrow definition of who I was and what I was to do, and I couldn't be flexible enough to respond out of it, and it completely turns me off, and I will guarantee you that will close you out of conversations you should be in for jobs.
So I also echo the thing about not asking questions. And you can ask what's your timeline for the recruitment, that's okay, but that's not your only question. Like, that doesn't count in that, what questions do you have for us piece. So, this sounds really basic, but don't complain about your previous job or coworkers at an interview. Save that for your friends at coffee, but people do that. And that's a number one, like, this is not gonna be a team player, someone who's not gonna bring positive energy to the workforce. That's the impression you give, so just don't do it. You may have left somewhere in not very good circumstances, but talk about what you learned and, talk about what you did well. We don't need to know that, you didn't like Susie and, the other thing I would say is answer the question you're asked. So many times I'll be with an interview panel and someone will leave the room and we'll go, I'm not sure they answered any of the questions we asked. They talked a lot, and but they talk around it, or they don't give specific examples. You may give an example of a project you worked on, but you're not clear about what your specific role was. This is the time where you want to be articulate about what it was you did and what the outcome was as a result of that. It doesn't mean you're not team oriented, but I need to know what you can do. At the same time, you don't want to exaggerate and be overblown about how, you were the only person that worked on the project, but you need to be specific. And I would just say, if you are sitting in an interview and you start to think to yourself, wow, I'm talking a lot, you might stop and look at the question and see if you're actually answering the question. So, because often, that happens, and it wastes your time and it wastes my time.
That's just good advice in life, too.
Oh, thank you. That's great. Did you have anything else, Danna?
No.
Did you? Okay. So
Did I answer the question?
Yes, you did. Thank you. Yes, for sure. Answer the question is the answer to Danna's question. So I want to open it up a little bit for some Q&A. It's hard to, I don't think we can get questions off the, okay. So you all get the benefit of asking questions. I'm going to prioritize the students over current employees, but if anyone's dying to ask one, get in the pipeline, we'll figure it out. So I'm going to open it up. Do any of our guests have anything? This clearly is a Friday afternoon audience, so don't hesitate to ask a question.
So I have a question. When I first heard about public health, I actually hadn't heard about it before. It was a year before I applied after college. So I was wondering, did you grow up knowing about public health at all? And when did you first hear about it? Like, public health? Epidemiology, what's this?
I did not know what public health was until I started in this building. And I was doing policy work, and I didn't care about the issues I was working on. It was stuff like things that are not good for your health, I'll just say that. And I knew I cared about health, but I knew I didn't want to do direct service. And when I got here, I had been working on a campaign, and they needed someone to help with their legislative work. So I came here and someone told me what public health was, and I was like, oh, that's what I care about. And it was such a great aha moment, and I've been here for 20 years ever since, because it was that, for me, that marriage of policy and health. But I did have to learn exactly what it was. But like I said, it's I don't have a public health degree. My degree's in public administration, and I really love thinking about how governmental public health can help assure the health for all people in Oregon. So I had no idea what it was.
Same way here. Back in my college days, in 1978, the average number of major changes back then was like 5 times in a 4-year period getting your bachelor's degree. I haven't kept up on that to know what it's like now. I would imagine there are a few people that, you know, when they were a wee little 5-year-old, had figured out what they want to do for their life's calling. I know there are people like that. I think, though, for most of us, it doesn't work that way. And you start off one direction and you end up going a different direction, and then other opportunities present themselves and you pursue them or you don't. I always believed, I wanted to have some type of a foundational education, because I did believe that wherever I end up going, if I was trainable, I would have opportunities, okay? And that's borne out for me. So, I mean, I've done a lot of different things in my life. I didn't pursue public health. I did ultimately, but I didn't know it was there, you know. It was just in my search or exploration for my final frontier, that's all. Yeah.
Comments from the panel?
I totally fell into public health. I needed a job, and got a job in Jefferson County. I hadn't even moved there yet, but my family was, and for the tobacco prevention work there that's funded here, and that was my start in public health. I actually have a Master of Divinity, and I'm an ordained United Methodist minister, and but obviously, you know, I fell into public health and feel like I get to do social justice work every day.
Counsel me.
So I have a master's degree in public health, but I came to it through anthropology. I was studying archaeology and just by chance took a medical anthropology class and really got interested in medical anthropology, and got some really good advice from a professor that I was working for that said, don't get a master's degree in medical anthropology, get one in public health. And you can quit that bakery job that you don't like. So that's how I got here.
All right, so we're all in agreement. We didn't know we were going to be in public health. My parents would tell you that I'm supposed to be a lawyer. It didn't take long after my bachelor's in psychology for me to apply to law school. I checked it out and realized it was a really bad fit for me. I very quickly went to South America and studied weaving. And while that was an amazing path for me, what I can tell you is that weaving with indigenous women in South America, in Peru in particular, it taught me that there are inequities that we have to address. And if our government in particular has a piece in building those inequities, I have a responsibility to act on it. And that gave me a mission, and I went back and got my doctorate. Not in public health.
But you still got here.
Yeah.
Are there any other questions? Yeah.
And you kind of fell into what was percolating. One of the things that I've noticed a tangent through all of what you guys were talking about was how we are changing, or how data is beginning to lead us. But as we have research which produces our data, if you could tell me what are some ways you see us moving from research into practice, especially with our populations that are underserved or difficult to reach, where we have data and we look at interventions but they aren't working. And as we move to having to do community building, which is extremely difficult, what are some ways that you guys are hoping to see in your candidates, or as public health moves into the future, of taking what research we have and really translating that into practice, and how can we do that effectively across multiple and diverse populations?
Well, it's a great question. I think an acknowledgement in public health that this solution is in the community is the modern public health, where we need to go. How we have to listen, we have to understand what the needs are and how to help provide the support, provide the data when available, and if not available, figure out how to get it. And then what we talked about earlier about communication, how to communicate that in an effective way so the community can use those data to address the needs of their community, whether it's a communicable disease issue or tobacco prevention. But that governmental public health plays a really important role in providing that financial support, whether it's for literally community organizing, collecting data, analyzing it, and getting it back out. And I just think that is actually a shift for a lot of public health. And I'm really excited about the future of public health, because what we've seen in all of these issues is when real progress is made, it's when the community is engaged and listened to and has the information that they need to come up with their solutions. So I think the other thing I want to say before I lose the floor is public health is really fun. It is a really fun, exciting place to be, and you get to work with amazing people. And so we can complain here and there, but it is a really, really great field to be in. So I just wanted to make that plug for public health.
Thank you, that was a wonderful answer, I appreciate it.
I just had a little tie-on to that. I think that we're also looking, or it seems to me like it's a more recent direction around data and collecting equitable data, or being, trying to involve the target or focal populations that we're working with in the data collection and design of the instruments and the whole gamut. I also think there's a much bigger emphasis now on qualitative data, which we haven't always, it seems like we haven't always appreciated. And so I think both of those things are helping us to be a little more culturally responsive to the communities that we're trying to work with and within.
And I think along those same lines, how we fund public health is going to need the systems by which we fund public health. There's a lot of work that needs to happen to make sure we're getting funding to where the need and the inequities are. And that's a dramatic system change. I think that's where we're headed, but it's going to take us some time to get there. So I think the incoming workforce is really going to help solidify that into place.
Are you going for it, David?
I'll just give you, this is a little bit of a different angle, but if you're talking about rural medical providers, small community hospitals, things of that sort, we actually bump up against that. There was a company that produces a portable handheld x-ray unit. Everybody had dental x-rays done, right? And you all pull it off the arm and you sit in your chair and have your vest. In terms of data and research, we got involved in evaluating a company's handheld x-ray device. And it became important because you want to make sure it's a patient safety issue, the operators are safe, they aren't having backscatter radiation exposure. And it has huge implications when you talk about outreach efforts. So we took a lot of time, actually ended up in a tort claim, and came away, and after about a 2.5-year period of really comprehensive work, freed up that specific device to be used. So, it takes sometimes major effort, and yet it's our due diligence to ensure that in the long run we're setting up standards so that other devices or emerging technologies coming in the marketplace are safe and can be used to betterment for most Oregonians.
We've got Brenda. Can I add
Go for
a
it.
couple of things?
Yes.
So thank you for buying time for me as I process. That's a really excellent question, and I was trying to think of what the words are to frame my thinking about it. And so you all laid it out really nicely, and I think that there's a piece in there that we all probably were thinking but didn't quite get. So it's not just engagement of communities and individuals in non-traditional ways. So when I went to school, I was taught to always go to whoever ran the local church and get their buy-in and then move forward. And what I found really quickly in Southeast Asia is that there were no women who were running churches. And the women were bearing the brunt of the cost of whatever intervention I was doing. So we ended up doing a time study to look at how much time the women in this community were devoting to responding to our various public health expectations of them, because their religious congregations, I guess we could call them, had said, yes, the community will participate. And then we went to the women and we said, wow, this is a lot of time. Look at this data. What do you think about this data? And then we had a real conversation about what is a priority for you? What is going to change the life of your family? How is it going to make a difference? And that's the piece that I think we weren't reflecting, that I think we're thinking about. It's not just what is the problem and what is the solution that we want to engage the people we care about in. It is, here's some data. What do you think about this data? What does this mean for you? And how are we going to know if we're going to have a success? And that may be a success with the metric that's, in a 1 to 100 scale, but it may be something much more qualitative that's going to show real progress. And that's kind of the engagement that we need to have at this point to move the needle on some of these public health problems.
Thank you all. If there are more questions, I am going to encourage informational interviews. I know all of these candidates would happily do that. I actually really do know that from all of them. Those are always great opportunities to learn more and to explore, and then they refer to others and you end up talking to a whole bunch of people. So I really encourage that for more questions. Thank you all for spending a beautiful sunny afternoon here talking about something that really celebrates this amazing work that we do. And I would like to thank the panel who was frank and honest and just so awesome. So thank you very much. Great.
So I just want to acknowledge Kirsten. The Health Promotion Crime Disease Prevention section was asked to do Public Health Week, kind of help organize it this year. And next year, a different section will be asked that. So if you work in a section and you guys want to do it, let us know. I'm sure they'll be lined up on Monday.